No more lupus. Lupus erythematosus is a common chronic, recurrent autoimmune disease. The specific cause of the disease is still unclear, but it may be related to genetic, hormonal, immune and environmental factors. This disease is mainly seen in women of childbearing age and often has familial clustering. Lupus erythematosus can be divided into cutaneous lupus erythematosus (CLE) and systemic lupus erythematosus (SLE) according to the site of the lesion. Among them, cutaneous lupus erythematosus can be divided into acute cutaneous lupus erythematosus (ACLE), subacute cutaneous lupus erythematosus (SCLE), and chronic cutaneous lupus erythematosus (CCLE). In terms of treatment, there is currently no cure for lupus erythematosus. However, early diagnosis and standardized comprehensive treatment can improve the condition. The disease can be controlled in most patients, and they can work, live and have children normally. In addition, for lupus erythematosus, the main way to prevent it is to avoid long-term exposure to sunlight, because sunlight can trigger the onset of the disease. Lupus erythematosus is not an infectious disease and is not contagious. Systemic lupus erythematosus. Because multiple organs can be affected, the symptoms are diverse and complex. 1. Systemic symptoms. Fever, mainly low and moderate fever, fatigue, tiredness, anorexia, weight loss, etc. 2. Skin and mucosal symptoms, including butterfly erythema, mucosal ulcers, hair loss and alopecia areata, as well as red painful nodules on the fingers and palms, periungual erythema, skin ulcers, ischemic necrosis of fingertips, etc. Among them, erythematous rash occurs in about half of the patients, and the incidence rate is lower in early patients. 3. Muscle and joint symptoms, joint pain and limited activity, myalgia and muscle weakness. 4. Neuropsychiatric symptoms, such as headache, delirium, epilepsy, delusion or hallucination, coma, peripheral neuritis and other manifestations. 5. Symptoms of kidney involvement. There may be hematuria, increased blood pressure, generalized edema, loss of appetite, nausea and vomiting in the morning, itchy skin, bleeding tendency and other symptoms. 6. Symptoms of lung involvement. It can manifest as alveolitis, interstitial pneumonia, bronchiolitis, alveolar hemorrhage and other clinical symptoms. 7. Symptoms of blood system involvement, including anemia, leukopenia and thrombocytopenia, and some patients may also have mild or moderate lymphadenopathy. Specifically, it may manifest as pale skin and mucous membranes, fatigue, dizziness, loss of appetite, bleeding tendency, etc. 8. Symptoms of cardiovascular system involvement. It may show symptoms of pericarditis, endocarditis, myocardial damage, and coronary artery damage. Specifically, it may manifest as discomfort in the precordial area, shortness of breath, palpitations, heart failure, etc. 9. Symptoms of digestive system involvement. In addition to non-specific symptoms such as loss of appetite, nausea, vomiting, and abdominal pain, if it causes lesions in organs such as the intestines, pancreas, and liver, there will also be corresponding manifestations. 10. Symptoms of tear gland and salivary gland involvement. Dry mouth and eyes may occur. 11. Symptoms of eye involvement, mainly decreased vision, even blindness. 12. Symptoms of serositis, manifested as pleural effusion, pericardial effusion, and peritoneal effusion, etc. Specific symptoms may include chest tightness, shortness of breath, difficulty breathing, palpitations, abdominal distension, and loss of appetite.